Good afternoon, everybody, and thank you for joining us for the importance of school-based mental health programs. My name is Bethany Lilly, and I'm a policy attorney with the Bazelon Center for Mental Health Law. The Bazelon Center is one of the founding partner organizations for a briefing that we annually hold in honor of Children's Mental Health Day, usually around the beginning of May. Our other founding organizations are the American Academy of Child and Adolescent Psychiatry. Michael is in the back of the room. He'll give a wave. Mental Health America, and Debbie is always very noticeable by her silver hair. The National Alliance on Mental Illness, NAMI, represented by Darcy and Emily, who are right there. And the National Federation of Families for Children's Mental Health, and Laura and Joy are right there. So thanks to all of our organizations for setting this up, but also especially for Representative Grace Napolitano, who is always a champion on these issues, and I'd like to invite her up to give a bit of a welcome. Just as a bit of background, Representative Napolitano was first elected in 1998 and has served since... Okay, I will just turn it over to you then.
Thank you so much. As many people know, I hate bios. If you want to read it, look me up somewhere. But I really thank all of you, especially the advocates for the mental health, illness and assistance and everything. This is an ongoing thing that we've done for many years, and we'll continue to do it with your support, naturally. But there's some people really that have stepped up to the plate and have continued to give, not only of their time, but of their talents, and connected us. And one of them is Jill Diamond from the World Boxing Council, that she's got the fighters wearing the green ribbons and the promoters and dedicating to mental health awareness. And doing research in trauma to the head. I mean, these are things that they've started over a decade ago with UCLA, trying to get to the bottom of these issues. So, but to our panelists, thank you so very much. To our advocates, thank you for hanging in there with us. To all of you who are here, stay tuned. We need your help. We need you to be able to carry the message, whether it's to your offices, to the constituency. The more we talk about it, the more we're advancing reduction of stigma, which is one of the biggest issues we face. And I see the mother of she was with us this morning, who's here because she has a child that had problems. We all know somebody, or at least somebody have a relative. We all need to unite. We all need to be able to connect people to where they can get assistance to be able to deal with these things. And I know people call me, I direct them to people that I know, and somehow this needs to be moving forward so that those people can advocate for the reduction of stigma and the funding to be able to do the things that we need done, especially for Mental Health in Schools Act, okay? It's millions of Americans are affected. We don't need to tell you that. And you know the symptoms. How many of you know some of the symptoms of a mental illness? Anybody? Raise your hand. Well, we want to teach you some more of that, and as we move along, we'll be doing that, hopefully. The month of May will and does draw attention to the illness itself, to reducing the stigma. Please, if you can, wear the lime green. Can you tell I'm wearing lime green? I tell people, do not be afraid to speak up. Take action, take a step, seek help before anything else. And on my bill 1211, most of you already know it. If not, you can just pick it up in my website. This is the fourth Congress we're introducing it. We now have 2 Republican members that are smart enough and brave enough, Gibson and Katko. That are joining us in trying to get some funding for this bill. It's a bipartisan now. We have 26 schools in my district that we started the program this bill was patterned after. It's successful so far. No attempt at suicides, which was suicide prevention, aimed at the children in schools on site clinicians. We must start them at an early age so that as they grow into productive adults, we don't have as many problems. We need to communicate your involvement. We need to network, so please network with the people around you. Learn the warning signs, the extreme changes in behavior, the verbal clues, etc. We must continue to educate our general public, especially parents, to be able to seek help. The National Crisis Hotline is 1-800-273-TALK. or 8255. It's a 24-hour confidential hotline and assists veterans too. Now, you have packets that if you have any questions, please don't hesitate. I'll make this short because you need to hear from the folks up here. So thank you very much. God bless you for attending.
And without any further ado, we'll move on to our speakers because they're sharing their expertise with us, and we'd really like to hear from them. Our first speaker will be Kana Enomoto, who was appointed in August 2011 as the Principal Deputy Administrator for SAMHSA. In this capacity, Ms. Enomoto serves as the principal advisor to the administrator on policies and programmatic activities with more than 600 employees and a fiscal year budget of approximately $3.5 billion. Ms. Enomoto brings 23 years of experience in the behavioral health field, 15 of which have been in federal service at SAMHSA. And I'll just turn it over to you right now.
I don't like bios either, but I don't quite have the gravitas of Congresswoman Napolitano to pull it off. That's right. Thank you so much, Congresswoman Napolitano. You are a beacon of hope for those of us who are champions for mental health, particularly the mental health of children. You've been such a great spokesperson for us and a leader in Congress, and this is a time when we need it the most. So we at SAMHSA, the administration, Administrator Hyde and I really owe you a debt of gratitude. I'm not here to lobby, but if anyone would like to educate their members about the importance of these programs and the costs, yes. And by paying attention to children's mental health, we will save money. I think that is the bottom line message as well. It'll also save lives. And also the organizers and the sponsors of this event have been stalwart friends of SAMHSA. We support your mission, and we know that you support ours. Thank you so much for this convening. It's exciting. We all believe in the prevention of mental illness, the promotion of mental health, of resiliency, early access to treatment, and fostering recovery for young people. And today, thinking about what the important role is of schools in that space. We've been at this event before, SAMHSA, and we're very happy to be here again, particularly as National Children's Mental Health Awareness Week is next week, when I'm going to be wearing my green. I only have one dress, so I have to parse it out. But no, and we hope that everyone joins us on May 7th, and there's a flyer, I think, out in the front. Maybe most of you know, but many people really don't know the prevalence of mental illnesses, serious emotional disturbances, and substance use disorders in our nation. And data are telling us that 1 in 4 Americans at any given time is experiencing one of these conditions. And so when we hear that 68% of people wouldn't want to live next door to a person with a mental illness or have a person with a mental illness in their families, all they need to do is look around, right? Because 2/3 of Americans will be sorely surprised to find that they may be married to a person with a mental illness, they have a family member with a mental illness, or they have a neighbor or a coworker with a mental illness or a substance use disorder, and they don't even know it. And we have to make the change. We have to change direction. We have to talk about it, and we have to raise awareness so that people don't treat these as special or different, or that they're special in that, you know, they're very fundamental to our success in life, and they're not something to put away. We don't shy away from people with diabetes. We don't shy away from people with cancer. We don't shy away from someone with a broken leg, and so we shouldn't shy away from a child or an adult with a mental illness. And yet, we know that 1 out of 10, our NISDA, our National Survey on Drug Use and Health, found that 1 in 10 adolescents suffered from a major depressive episode last year. 1 in 10. And how many do you think got treatment? Some of you know. How many? Who knows? Less than half. 38%. Only 38% of kids got treatment. And depression is a life-threatening condition. We know that. And with any other life-threatening condition, would we find it acceptable that only 38% of children got treatment? Absolutely not. And so we need to get this message loud and clear to everyone and anyone who can help us with it. The human costs are incredible, over $250 billion a year for untreated mental illness, for mental, emotional, and behavioral disorders among youth. And we need to create healthy environments in schools, and we need to prepare the teachers, the administrators, the family members, the parents, everyone in schools to surround our youth with the environments they need to thrive, both academically and in life. So we at SAMHSA are very grateful for the incredible research that's out there that tells us that early intervention, that prevention, that promoting mental health in schools, in colleges, and in universities, it works. It works, and we can do this. For many years, for over a dozen years, with the support of Congress, SAMHSA has funded the Safe Schools, Healthy Students program, where we have put over $2 billion into local educational agencies, as well as, and most recently, in state educational agencies, to foster 5 major components of a program which have been documented by the Institute of Medicine: safe school environments and violence prevention activities, alcohol and other drug prevention activities, student behavioral, social, and emotional supports, mental health services, and early childhood social and emotional learning programs. And these programs are showing great outcomes. With this investment, the president has decided to try to take this program to scale through his Now is the Time initiative and Project Aware. Because what we saw in our Safe Schools, Healthy Students grants was that the number of students receiving school-based mental health services doubled. The number of students receiving community-based mental health service went up by one and a half times, 143%. And nearly 90% of staff in schools said they were better able to detect mental health problems among their students after their school district had implemented the Safe Schools, Healthy Students program. We also found that the number of kids who said that they had been in a physical fight at school went down. It went from 19% down to 13%. And we know that actually the experiences of violence by our young children are startlingly high. Substance abuse, similarly, was reduced from 24% to 18%. So by creating these healthy school climates, by doing these positive emotional supports in schools, by giving access to supportive services, partnering between schools, criminal justice, juvenile justice, community organizations, and community mental health, we have, and family members and youth themselves, we have created healthier communities. With Now is the Time, which was born after the Sandy Hook Elementary School tragedy, the president proposed funding for programs to protect our children and our communities by increasing access to mental health services. With the Project Aware that I mentioned, we've funded 20 state educational authorities at about $2 million per year for 5 years to develop the necessary systems in their state school districts, again, using 3 pilot school districts, or LEAs, because we have this model that worked with $2 billion and 12 years. No state was doing Safe Schools, Healthy Students statewide, even though we had the results, even though we had the data. And so that's where the president has put his support behind Project Aware. We also have 100 Project Aware local educational agency grants, which is for schools and school districts to work with their communities, with parents, with youth, to promote mental health first aid and youth mental health first aid to increase behavioral health literacy, so people know the signs. People can detect these things early, and we know that early intervention is very important. We're, of course, working hand in glove with the Department of Education and the Department of Justice with their Now is the Time programs, because we know that all of these systems have to work together, because kids don't live in a vacuum. They don't just live in our families. They live in ecologies. And we have to partner at the federal level with all of those agencies that have a role in fostering a positive ecology for every child. Another place where Now is the Time is emphasized and where SAMHSA is really proud of our work is in Healthy Transitions. That's a new program that we got in 2014, and that is fostering connections for those kids that are 18 to 25 or 16 to 25 as they're at that very precarious stage of life. Not only do we know that half of all mental disorders show up by the age of 14 and 3/4 by the age of 24, so there are some kids that are first experiencing the signs of illness at this very delicate time. We also know that kids who are in youth serving systems and are already being served have challenges as they make that transition to the adult serving systems, and the danger is that they can fall through the cracks if they don't get the services and the supports that they need, that their parents don't get the peer supports that they need to successfully navigate that transition. And so we're really pleased with the $20 million that we have for our Healthy Transitions program. Another effort that most of you probably already know about is our very successful and long-standing Systems of Care program, or our Children's Mental Health Initiative, which has served kids up to the age of 21 and their families with serious emotional disturbances. This program has had an impact on millions of America's children by funding state and local agencies, tribes, and territories to develop, implement, and sustain services, wraparound services for children and their families that bring together schools and parents and churches and synagogues and youth groups and others everyone who is touching those kids, child welfare, everyone who's touching the kids and can be supportive and make sure that those children are getting all the things that they need around their communities. It's a very holistic approach, which we also wanted to take to the tribes, and so we've had our Circles of Care program, which builds off the Systems of Care program, but allows tribes to define their own system of care for wrapping around their youth. Because we know that tribes are sovereign governments, and they have their own traditions, their own languages, and they need to be able to form a service system that works for their youth. Over the past 17 years, we've seen incredible tribal communities mobilizing and developing tools necessary to plan for the particular needs of their young people. As we move early on the trajectory, SAMHSA is really proud to have supported the Good Behavior Game. This is a program often done in the first and second grades where it's a universal evidence-based preventive practice where we've seen great progress. We've done some grants to some schools that had at least 50% free and reduced lunches. And these programs address early aggressive and disruptive behavior, which is a powerful risk factor for later emotional distress. And we've seen reductions in the aggressive and disruptive behavior in the young kids, but then following them over time, children who participate in the Good Behavior Game in first and second grade have less juvenile justice involvement, they have better school completion rates, they have less substance abuse rates, and less abuse of alcohol and tobacco, as well as fewer personality disorder and other mental illnesses developing later in life. So that early period, the early developmental period, is so important. We also know that later years are important. So the adolescent years, campus, going to college, those young people who don't go to college, that's when we know that a lot of young people are at high risk for suicide. And SAMHSA has been co-facilitating the National Strategy for Suicide Prevention with our colleagues across federal government. And I'm sorry to say that we have now reached over 40,000 suicide deaths in 2013. Right? The number is still growing. And despite our efforts, we know that we can do things with young people to intervene, to follow up, to do prevention work, to create networks so that they can talk to people and get supports, but we don't have enough resources to do it everywhere that we need to. We also know from other countries that there are incredible models where you have primary care follow-ups, where you do really aggressive screening and intervention for some of the really high risk factors in middle-aged populations who are actually the highest numbers of suicides, and we don't have the resources to do that either, and that affects families as well. So we know that we need to do more with our campus suicide. We need to do more on suicide prevention in general. Something that we're really looking forward to is another tribal initiative, a tribal behavioral health grant, where we're doing suicide prevention as well as substance use prevention and allowing, this is a 2016 proposal, where tribes would be encouraged to partner with their BIE schools and to address the mental health problems, the substance abuse problems that are showing up in the schools that are getting in the way of tribal youth's academic success. Because it's very hard to concentrate in school for anyone if you've got so many mental health problems, or if you've got trauma in your family or in yourself. That is very hard to get past and to achieve academic success. And we know that's really important for all of our youth, but for tribal youth in particular, there are such significant struggles in those communities. So SAMHSA is partnering, again, with BIE, with IHS, and our other colleagues across the department to do this important work. And finally, as I mentioned, I'm happy to say that this is the 10th anniversary of Children's Mental Health Awareness Day. And so we do hope that you all will join us on May 7th. We're excited. We have Mary Lambert joining us as a special guest, and it's going to be a great, great day. We thank you for helping to bring mental health and substance abuse issues out of the shadows. I think this is a great event, and I appreciate all of your efforts. So please let us know if SAMHSA can be helpful in the future. Thanks.
And so our next speaker will be Jill Diamond. Jill Diamond is the chair of World Boxing Cares, a program that reaches out to impoverished children in 164 countries. Her journey sent her across the globe as an official and supervisor of the championship bouts and as an ambassador for various charitable programs. Ms. Diamond's commitment was recognized with the Boxing Humanitarian Award, WBC's Women of the Year, New York City's PAL 911 Award, and was acknowledged by the California legislature for her work with women athletes. In addition, Jill writes for several media outlets, and I will stop the biography now.
Hello, everyone. I'm probably the least qualified person here to talk about this, but my qualification comes from life experience, I would say. I grew up in a home where my much older brother was quite ill. He was handsome, he was smart, he was funny, and then he went off to college, and a month later he came back, and that was the beginning of the journey for us. The lucky part was that he never hurt anyone outside of the home, and today, many, many years later, he is taken care of in a very wonderful facility where he's safe, and that's considered a success story. I don't consider that a success story. This is 40 years later, and still many children would rather kill themselves than come forward and risk the shame of rejection and stigmatization because they won't ask for help. This has to stop. We can't cure everyone, but we can change our perspective about this illness. So at the World Boxing Council, which seems like an unlikely organization to get involved in mental health awareness, it completely isn't. Many of our boxers, many of our athletes come from very disadvantaged backgrounds. They've dealt with poverty. They're very damaged people, some of them, and they see boxing as a way to elevate their lives, to become normal, whatever normal means, to get, reward from their sport. And so what we do, in addition to boxing, is we travel through countries, youth centers, hospitals. Our boxers go in and they tell their stories. And the children really respond to them, particularly boxers that come from their area. They tell them, if I can make it, you can make it. When I get hit and I fall down, I get up. You can get up. They are very fragile people outside of the ring, and they are very open and willing to share their experiences, and I think that it's very inspirational to the people that we come and visit. So out of respect and support to Grace, we are honoring the month of May. This year also, we will be wearing the green ribbons at every fight, including the fight that's happening this Saturday, Mayweather and Pacquiao. We dedicate our month to mental health awareness in hopes of knocking out the stigma. Thank you.
And our next speaker will be Dr. Dana Cunningham. Dana graduated from Southern Illinois University at Carbondale with a doctoral degree in clinical psychology in 2004. Following the completion of her internship at the University of Maryland Medical System / Maryland Veterans Administration Consortium, she completed a postdoc at the Center for School Mental Health. Currently, Dr. Cunningham is the coordinator for the Prince George's School Mental Health Initiative. And I'm not even going to attempt that acronym.
Thank you. Good afternoon, and thank you for inviting me here today. It's a pleasure to be here. And I think you have a copy of my PowerPoint slides in your green folders. So I'm here today to talk just briefly about school mental health and the value and importance of school mental health services. The title of my presentation is about increasing access and improving outcomes. And I believe that by providing school mental health services, that we can improve access for mental health, for youth to receive those services, and also to improve outcomes for them. Just to give everybody a clear definition about what school mental health is or what it looks like, there's some key components to mental health. That's when it's implemented well, we usually see a partnership between the schools and the communities that is undergirded by families and youth, and making sure that their voices are a part of the work that we're doing. We see that school mental health programs really build on existing partnerships that are already taking place in the schools. So it's not our intention to come in and take over the role of a school psychologist or a school social worker, but to really help support what's already taking place in the school environment. And the goal is to really focus on all students, not just a subset of students, so all students can benefit from mental health services that are based in the school. So there's really a full array of services that can be provided in a school setting, from school mental health promotion. For instance, you might have a broad school-based bullying prevention program that all students, all staff members would participate in. There might be a subset of students who might need more specialized attention and treatment. So perhaps maybe a group of students who may be at risk for a substance abuse disorder, a group of students who maybe have been exposed to trauma can receive more of what we call secondary level of prevention. And then there might be a smaller subset of students who might need more individualized treatment because they are at risk for significant challenges. So why are schools an optimal place to provide these services? One of the things that I think kind of probably provided a very good overview about the importance of school mental health services is because we know that the onset of mental illness, many mental illnesses begin in childhood, many of them before the age of 18. So if those illnesses go on untreated, there's a significant cost to that. And so, as we know, there's, as was mentioned earlier, there's about 1 in every 5 students have some sort of mental health illness, and about 1 in 10 are really impacted by a significant impairment. But the reality is that many of those youth are not receiving services. The good news is that we know that youth that do receive services, the overwhelming majority of them are able to receive those services in the school environment. So there's research that shows over 75% of students are actually receiving mental health services in the school setting. We know that there's some barriers to receiving mental health care in a traditional outpatient setting. I certainly don't have to go over all those with you, but certainly things like stigma or insurance are barriers, transportation, past experiences with mental health agencies that have not been positive sometimes steer people away from seeking those services in a community setting. We know that traditionally in many outpatient settings, it's in some instances, people after they make their first appointment don't even show up to that first appointment. And beyond that, the most frequent number of times that people actually go to an outpatient mental health center for services is 1. So they may go to that first appointment, but don't frequently return. And so we see over time that many people discontinue treatment or don't continue with treatment. And so that is why schools provide, I believe, a really optimal place providing those services. For one, yes, students are certainly there and it's easy to access them. But in addition to that, there's also the ability to reduce the stigma of seeking mental health services because the counselors are based there in the school. Students can see their friends going to see a counselor, and it's not, I've had students bring students in to come see me and talk to me because they feel that it's a safe place to be, it's a good place to receive services. So it's definitely less threatening. We heard earlier about some of the statistics with depression and suicide. I think being present in a school environment allows you that opportunity to see those students who might be isolated, to see that student who sits in the back of the classroom with their head on their desk and is not really engaged. Oftentimes in schools, the students that we typically get our attention are those that are making a lot of noise, but when we're based in the school setting, it's definitely much easier to also reach out to those students who might be suffering some of those internalizing disorders such as depression or anxiety. So if I had to sum all of that up in terms of the advantages, I would say that when students have their social, emotional, behavioral needs addressed through wellness, prevention, and intervention, there are fewer barriers to learning and more time for productive classroom instruction. And we see that there's really, some people have concerns about the impact of school on academics and say, well, maybe that will take time away from a student's learning time. But we know that if students' mental health needs aren't addressed, they're going to have difficulty learning and difficulty performing well in school. And we do also know through lots of research that's been done about the positive impacts of providing mental health services and some of those, the ability of school mental health services to reduce some of those non-academic barriers to learning. So we see that students are more engaged in school, that they can perform better academically, that we see fewer students going out to participate in more restrictive school placements. So in overall improving academic outcomes, decreased dropout rates. So there are lots of positive advantages of receiving school mental health services, and actually the Center for School Mental Health, where I work, is dedicated to improving the advancement of school mental health practice and policy. And on their homepage, that's listed there, if you can see it on your handouts, but it's csmh.umaryland.edu. But on their homepage, there is a link to a whole list of academic outcomes and impact of school mental health services on other positive outcomes, if you want to look at that. We know as well that school mental health certainly reduces long-term costs. If we think about, the cost of, I said earlier, we talked earlier about the number of students who exhibit mental health illnesses in adolescence and prior to the age of 18. So if those students go on and become adults and have mental health problems that are not treated, what is the impact of that going to be on our workforce, on the justice system, on the healthcare system? So if we don't treat those problems early, long term, that certainly is going to be quite costly in terms of dealing with those issues in the future. Within our program, we have had an opportunity, I've kind of told you what the research has said about the benefits of school mental health, but we've also have simply asked the families and students, what do you think? How have these services benefited you? And some of the things we hear family members have said are that, the therapists are always available. A grandparent said that her daughter was less angry. A case manager helped her get back on her feet. So families are able to certainly see the benefit, and similarly when we ask youth, they report positive experiences as well, that they appreciate having somebody right there. They can get their feelings off their chest. One person noted that it's free, and that was from a young student who actually had experienced the challenges. He saw his mother having difficulty paying for the insurance copay. So he was very happy to see that, there was a service that was available there in the school that didn't require a cost. So just to tell you very briefly about our program, again, it's the Prince George's School Mental Health Initiative. We're based right across the way. We have a few of our staff members here. Thank you for being here. And we're based in Prince George's County, Maryland, and we really have a great collaboration between the Prince George's County Department of Special Education, the Maryland State Department of Education, and the University of Maryland, Baltimore. And the purpose of our program is to really provide more intensive services and supports to students who are at risk of being removed from their homeschool placement. So we really focus on that population of students, but we also do a lot to really help enhance staff training and staff competency, provide some training and family outreach as well. We provide individual therapy, group therapy, prevention activities, really the whole range of mental health services that you could receive in the community. We provide them there in the school. We also actually have a psychiatrist who provides consultation services as well. So it's a very comprehensive program. In terms of the students that we see, as I mentioned, we really focus on students with disabilities, but we also have had a wonderful partnership over the last couple of years with some of the local graduate school programs, and so they also provide services to students who are in general education as well. So we really are able to serve a broad range of students. And you also, I'm not sure how well you can see this in your handouts, but we've also done some research over the last couple of years with our students who've been involved in our program. And one of the things that we do is observations of students' behavior at the beginning of the school year and at the end of the school year, and try to look for areas of change.